button is weird.
We're on live.
We're on.
Woohoo!
And Jim's sweating.
Here we go. Yep.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here today with Jim, who's sweating, and we are going to be talking about stem cells, hormone replacement therapy. And my recent trip to Utah was pretty awesome. But anyways, we're going to cut the break, and we'll be right back.
Jim, who's sweating.
I've never seen him sweat.
I'm Jim, who's sweating.
It is 68 degrees in here, and for Jim, it's 3,000 degrees.
I also, hey, no, I have a
menopause.
I have menopause.
No, it's andropause.
It's something that affects about 10% of the population. My dad, my late father, could sit in a room, air-conditioned room, drinking a cold beer and break a sweat in the middle of winter.
Yeah.
Yeah, and my brother has it worse than I do, but
take your shirt off.
While.
Guess you never got a sweater for
I'm not
Christmas.
going to take my shirt off. No thanks. No show, folks. No thanks.
Jim, who's shirtless.
Jim is shirtless and sweating in a 68-degree room.
All right, let's rock and roll.
Here we go.
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. We're going to talk today a little bit hormones. I think we're going to focus on female hormones a little bit. We've had a lot of questions about that recently. But I also want to share, I just got back from Utah. I went to Salt Lake City, Utah. I went with Dr. Bain, and she's our medical director, because we've been doing a lot of the stem cell procedures at Buckeye, and we wanted to go out there and actually see the facility where they harvested and processed these stem cells, because we're giving to our patients, we're getting really good results, but I wanted to see, the front side of it, where they come from, how's that processing go down. So we flew out there. It was a whirlwind trip. Have you ever been to Utah? I'm here with Mike, by the way.
I have not. Didn't you go out there and it was like 48 hours and you came back?
Yeah, it was a whirlwind. Yeah, because the flight out there is like 6 hours in the air, but you lose 3 hours, and yeah.
It already sounds very appealing to go to Utah.
Yeah, but it was pretty. I mean, we actually ended up staying in Park City, which is right out of Salt Lake, and that, if anyone hasn't been to Park Lake or Park City, it's beautiful, beautiful out there. I don't ski, but it was pretty awesome. But anyways, we went out there. That's where we use predictive stem cells. We went out there to check out how they process it, and it was a pretty incredible process. The stem cells. There's two types of stem cells people can use. There's autografts, which we do at Buckeye, and that's where we would harvest either your bone marrow or your own fat and get the stem cells out of your own body fat or bone marrow and put those in and to facilitate healing in joints. And then there's allografts, and allografts are from donors, and those donors are from we can use placentas, and these are from people that have elective C-sections and they donate the placenta, they throw it away anyways. Or the latest and greatest technology is umbilical cord. And we're not talking about umbilical cord blood, we're talking about umbilical cord tissue. And once again, when females have babies, they throw that cord out anyways. So an option they're giving to females now is, would you like to donate this for science? And those are the tissues that are used, that we're using in joint and getting really amazing results. And the cells we want to use in orthopedics, there's lots of different types of stem cells. But the mesenchymal stem cells, and mesenchymal stands for tissue stem cells, are the ones we use in orthopedics. And those mesenchymals have some really unique properties when you put them into a joint. And first of all, kind of what we're talking about here is, if you're listening, if you have degenerative joint disease, whether it's your knee, your back, your shoulder, wherever it's at, and a lot of people are told, you're going to have knee replacement, you're going to have your hip replaced, you're going to have your shoulder replaced. That's not the case anymore. Time has changed. Time has changed, and we've done almost 300 of these procedures at Buckeye. No one's done more of these allografts in Ohio, maybe even in the country. We got to be one of the top people, and the results we're getting are fantastic. We got people coming from other states here to do it with us. But we're literally, when you put these tissues in there, you get the body to heal itself. So when people are listening and say, well, do I even qualify for this? The first question I ask is, are you alive? Because if you're alive, you heal. You have the ability to heal, right? Right. If you're dead, we can't help you. Right. But if you're alive,
still try. But yeah.
Yeah. But if you're alive, you do have the ability to heal. And if you're doubting that, if you get cut, does it heal? And if the answer is yes, then your body does have the ability to heal. But the problem you have as you get older is, I think we'd all admit, as we get older, our ability to heal does become less and less. And there's two reasons for that. Reason number one, as we talk about hormones all the time, hormones in males and females, testosterone, estrogen, and growth hormone control how your body remodels, and the way the body works is pretty cool. Picture when we came over to the radio show today, Mike. You have a little mechanic at your house or house cleaner, and every day you leave, they're painting or they're cleaning and they're fixing up. That's your remodeling system. Your body's doing that all the time. Your skin's always replacing, hair's always replacing, joint tissue's regrowing. Everything in the body is always rejuvenating and getting replaced. That's run by your hormonal system. So when you're younger and you have higher levels of hormones, that remodeling, that maid works a lot faster.
Right.
As we get older and our hormonal system decreases and we have less testosterone, less growth hormone, less estrogen in males and females, the maid gets lazy. And that knee that you jammed when you fell that would get better in a day when you're a kid, it's 3 weeks later and the thing still hurts. Why? Because the body doesn't remodel properly. The other thing that happens, though, and there's two components to healing. The other thing that happens is stem cells. And stem cells are how the body heals, and we'll focus on joints and orthopedics, because that's what we do at Buckeye. If you have a knee injury and it should get better because your hormonal system, and because when you get an injury of any type, if you jam your knee or twist your ankle, the first thing that happens is those cells are damaged there. And when you have cells that are damaged, they send out a signal, and that signal is called a paracrine signal. And what that paracrine signal does is it signals your own body stem cells. We all have stem cells. If we didn't have stem cells, we'd be dead. But it signals your body to attract your own stem cells to that area. Once your stem cells come to that area, they attach to local vasculature. And once they do that, they change from a mesenchymal stem cell to this thing called a periocyte. So they just change the name once it attaches to the vasculature. And then once it becomes a periocyte, it releases growth factors. And it feeds your cells that are messed up from your injury or that are dying, and it brings them back to life. That's how healing occurs.
That's why what you're doing after the fact with stem cells and all that, that's why it's called regenerative medicine, right? So you are when you're younger, you can recover faster because your body's doing it for you.
You have more stem cells, and and the other thing you got to keep in mind here is that it's all about these growth factors. So the way you heal is stem cells go to an area and they literally feed your dying cells and bring them back to life. And the way they feed them is with growth factors, right?
But that's the natural process. What we're doing after the fact is when those have kind of died off or slowed down, you can regenerate them to speed up that process again. Correct.
But you can't regenerate your own cells, but you can cheat the system. So, we know as you get older, you have less stem cells. There's a lady, this lady, she just died in the past 5 years. She lived to be 115 years old. That was the oldest recorded human being to be alive. And when she died, she was fully functioning. She had full mental capabilities. She was very able, but she just died one day. And she, you can Google this, by the way. I can't think of her name. It's like a German name. But anyways, she donated her body to science, which is a cool thing. You see, what the heck did this lady do to be 115 years old and be fully able? And what they found during her autopsy is the reason she died is she had no stem cells left. So she didn't have an ability to heal. So if you don't have stem cells, you're dead. And that was kind of a cool thing, right? So, and who knows in the future, maybe we'll be able to do infusions of stem cells and we'd solve a problem like that. I mean, right now we're just doing it for joints and for blood cancers, but, the potential for the stem cell therapy is really unlimited, and if you go to clinicaltrials.gov is a government website, there's 4,000 studies going on worldwide with stem cells right now. So it's the future of medicine. The cynical side of me will come out and say, I think that research will go slow because just like bioidentical hormones, you can't patent a stem cell. So there's not a whole lot of money in it,
right?
Which stinks.
Yeah, which messes up the whole healthcare system if people were able to get better by doing this thing, whether going in once a month or once every 3 months versus sitting in a doctor's waiting room.
Yeah,
and the recommendation, as you always say, is, well, let's go ahead and do surgery on that.
Right.
So that's not preventative.
On the way in today is a crazy story. So on the way in today, and I can't use names obviously, but there's an NFL player we're treating at the office, and he's treating with a prominent orthopedist here in town. Had a major knee injury, had surgery, and it's just not healing. So he found us somehow. I think some other NFL players we treated in the past, which obviously I can't use their names, had recommended. So he comes in the back door. It's kind of on a DL. explained what we're going to do. He did his first treatment yesterday. We didn't do stem cells on him yet. We're doing some shockwave and laser and other stuff, but we're going to get there on him. And he called me this morning. He said, "Hey, Doc, I feel really good." And I called my surgeon. He's really mad at me. And I said, "What do you mean he's mad?" He thinks it's a waste of time, and I told him I'm doing better, but he just wants to do surgery. So that's what we're up against, which is crazy. Like, if this guy's feeling better after his first treatment, he just wants to play. This kid, all he's ever done is play football. He told me flat out, he goes, "If I can't play football, I don't know what I'm gonna do. I played football since I was 5 years old. This is my future. This is everything. If I can't get back and play in the NFL, I'm done." He's a local guy. He just wants to play. And he's like, he's torn. He's like, my surgeon's really mad at me right now. He goes, "I'm going to do what you say, but it's just an awkward situation. I don't know why he's not happy I did better."
Yeah, but it's cutting into his pocket. I mean, let's be honest. If he's getting better doing the hormones and even HRT.
Well, he doesn't need that stuff yet. So he's I want to say he's 22 or 23 years old, so, or no, he's 26, sorry, but he doesn't need hormones, but so we're just doing this other stuff, but it's kind of sad. But anyways, but anyways, back to that, stem cells do work. And I venture to say any pro athlete that has an injury or surgery at this point is going to either be doing, platelet-rich plasma, which is a regenerative procedure we do at Buckeye, or shockwave, or ozone injections, or stem cells, because it works every single time. There's no cases that it doesn't work. It works every time, unless the person's dead.
Well, you actually see more articles about it, especially if you're on Bleacher Report. You can see that people are. It seems whether it's a running back, whether it's a pitcher, that they are doing either ozone now or they're doing stem cell therapy because the method of the Tommy John surgery. If you tore your rotator cuff, you were out 14 to 18 months and it was grueling rehab. Now guys are coming back in 4 to 6 months and just doing stem cell therapy.
Yeah, it works. And, kind of a side note, I'm a big UFC fan, always have been. And not that there's a difference between doing bioidentical hormone therapy properly and people juicing up, right? I mean, we all know the difference. And, the UFC, once they brought in USADA to drug test, now there's no fights.
Right. Well, there's no fights after about 31 years old.
Yeah, my point being is doing bioidentical hormone replacement therapy allowed those guys to continue fighting. And particularly with the UFC, you can't come in all juiced up because you gas out anyway. So there's no advantage being, taking a bunch of steroids and being big.
Right.
But those guys that were using it to stay healthy allowed them to fight into their 30s. You're not going to see any fighters in their 30s anymore.
Because they can't, that regenerative medicine that's keeping them going.
But they're not allowed to do hormones. So USADA, you can't get around the drug testing.
Let me ask you this. If somebody was doing HRT therapy, let's use the UFC. If USADA doesn't come in, what happens when they are whether they cut back or just stop altogether? You're still, those aches and pains are going to come back, right? So you would do this procedure, but you do it to the end of time, right? Because it's healing your body constantly.
Correct. Yeah, there's two. So in the UFC, you could still use PRP and stem cells, and I'm sure those guys are doing those procedures. But if you are ahormonal or don't have hormones, and you got a picture, a UFC, we work with several local fighters that are pros, but they're not UFC level. Those guys literally train every single day
Like 10 hours a day.
Like ridiculous. When you are under, and most of them have jobs too. They're not getting paid anything. These guys' hormone levels are trash because when you train that hard and have that level of stress, it wrecks your endocrine system. Okay, that's why they're injured. But that's why allowing fighters, UFC fighters, it'll never happen now because USADA's there. But that's why the UFC was so good for so long, because you have young fighters, old fighters, and they were on equal ground because their hormones were the same. They had the same ability to heal. But now that USADA's there and there's no bioidentical hormones in the UFC at all, you can't get around it. There's not going to be any good fights. These guys are all done.
Or they're going to.
But they're young guys. They'll be young guys. Right. They're 25s, but you're not going to see many UFC fighters past 30. There's no way.
But let's take it to the average guy who, whether he's playing rec league softball or whatever, if he had played football his whole life and he's banged up, you've seen people that have come in at 27 have a lot of stress, their hormone levels are off. That conversation has to be very strange that you're going to have when you have their blood work and you say, this is garbage, like you're depleted in these areas. They probably think there's no way because I'm not 40, 50 years old. If you look at the people like a Sylvester Stallone and people like that are in their 60s and still look like a beast, they are doing these treatments.
You got to picture looking good and feeling good is a symptom of being good.
Right.
You know what I'm saying? So like, so you don't do I mean, obviously you look better when you take bioidenticals if you need them. You know what I'm saying? The blood work never lies. That's why come get your blood work done. But you know, how you look and how you feel is a byproduct of how you really are. You know what I'm saying? So if you're listening and you feel terrible, and you're putting on weight, and you have no energy, and your libido's down, and you're not as sharp mentally as you used to be, come get your blood work done. Because the other thing I see with young people, and age has nothing to do with your hormones. You can be in your 20s and have low T. You can be in your 50s and your testosterone's fine. So you can't use age to judge this thing. But what I see a lot clinically, which drives me nuts, is you have guys in their 20s and 30s that have all the low T symptoms. Low libido, no energy, mental fog. Can't focus, sleep patterns disrupted, aches and pains. And they'll go to their doctor, and the doctor will flat out say, "You're too young. You can't have low T. You must have depression. So let's put you on Wellbutrin or some other garbage." And then I see it every single week, and it makes no sense. Instead of just doing a blood work, do blood work. And I mean, if their testosterone's fine, their estrogen's fine, growth hormone's fine, cool. Then maybe they do have depression. But like, depression's so overdiagnosed in our society.
Well, because there's no blood test. It is, here are my symptoms I'm going to verbally tell you.
But the symptoms of low T, the symptoms of vitamin D deficiency, and the symptoms of depression are all the same thing.
Right.
So why not test for vitamin D deficiency, hormone deficiency? Test for those things. It's real simple. It's a simple blood test. And if you don't have those things, they have it, then maybe they do have depression, but way, way, way overdiagnosed. And once you start taking, depression medications, when do you stop? That's a forever.
Right. Well, that is a massive.
And you're messing with brain chemistry at that
Right.
point. Like that can't be good.
Well, you could become dependent on it.
Right.
I
So
mean, you can't become dependent by taking bioidenticals. You can't.
no, I mean, people will ask, "Is it safe?" I've heard all this bad. I heard my doctor said, testosterone is dangerous. Listen, there's not one study out there anywhere. I challenge someone to find a study. Now, when I say a study, I'm not talking about 3 people. A study where you have over 100 people and you follow those over 100 people for over 10 years that shows that bioidenticals is nothing but safe. Because there is none. There is no studies out there on bioidenticals that prove it's unsafe. Quite to the contrary, any long-term study with bioidenticals proves it's safe. And the logic by that is very simple. If you were deficient in a vitamin, Mike, say you're deficient in vitamin D, you would take vitamin D to fix that deficiency. And if you didn't, it would be unsafe, right?
Right.
The same things with testosterone, estrogen, and growth hormone. If you're deficient and you don't take it, it's dangerous. So it's the reverse logic on this, And I think once again you get all stuck up in this medical model. Well, why doesn't my doctor tell me this, or why don't I do this or that? What we do at Buckeye, there's a high level when you're on hormone replacement therapy. It requires a lot of management. You got to come in, you get a blood work 1 month after you start, and then every 20 weeks, and we have to adjust. And it just doesn't fit a regular medical practice. You have to be a specialty practice to do this.
But also, it is regulated. Take Dr. Boehner, for example. Once you get your blood work done, they've told you exactly where you're going. You can't go to the drugstore and fill this like a script. It gets mailed to you. So that's another safety part is you can't overdo it.
Because no 2 people are the same.
Right, but you can't overdo it. I can't get 3 or 4 kits at one time. It is regulated, and you have to call the office to make sure that your next order is coming when you're running low. So it's not, I think when people look at this, they say, oh, that's steroid abuse or whatever it is, which it is not, because the amount
A steroid is a drug. It's not a bioidentical. So there are steroids out there.
Right.
Anadrol, Dianabol. There's a bunch of those out there. Those are steroids. Those are drugs that mimic hormones.
Right, but they're not.
That's not a bioidentical. It's a totally different thing.
Right, but again, as far as the safety angle, it's mailed to your house. You have to sign for it, and you can't. I want to get 2 or 3 kits of this. It is, here's what matches your blood work, and this is what you need to have, and
Correct.
here's your dosages. So that is also taking the safety angle and upping it, because it's not something, you cannot abuse it.
Correct. So, and as I said, it's unsafe not to get your hormones checked, and it's unsafe if you're deficient not to be on hormones. So don't even think about it, you're going to feel a lot better and all this other stuff. I don't even care about that. It's unsafe. And you got this other anomaly out there. If you have low testosterone, your cholesterol is going to be high. Simple, right? Why is that? Well, because cholesterol turns into testosterone. So if you're low testosterone, your body's natural response is to increase cholesterol. It's that simple. So what most doctors will do, though, oh, you have high cholesterol, let's put you on a statin. Let's get rid of all your cholesterol. Cholesterol is essential for life. If you don't have cholesterol, you'll never find one person, if you're listening on here, if you're on a statin, you feel terrible. You'll never have a person say, hey, man, I take these statins, I feel great. Why is that? Because it wipes out all your hormones. So if you wipe out your hormones, you wipe out your remodeling system. You can't heal.
Which then you would need hormone replacement therapy anyway to counter that.
Yeah, and more research, if you really look, now they're saying that now these studies are coming back, they're saying people on statins don't live as long as people off statins. So what the hell are we doing?
Right.
So anyway, but that's one of the situations let's invent a drug. So now we got this drug, the statin drug, that's not creating a disease. There's no correlation whatsoever to heart disease and high cholesterol. That's all BS.
Well, I also think that when you're looking at drug companies, when you see them on TV or in the newspaper and all that, the warning label is longer than what they say that the thing will do for you. When it's bioidenticals, that speech is literally, 30 seconds to a minute long?
Yeah,
here's what it is, here's what it does, here's the time.
There's literally no side effects because you're just simply replacing what the body quit producing. Right. Period. It's identical.
But the marketing of these drugs is, take this, you're going to be happy, you're going to sleep perfectly and all that. Your system is off. So you need the HRT to do this. We started talking about stem cells, but if you're taking HRT and then you need stem cells, it all works together because you are healing the body, and you guys don't prescribe any opioids, which is
last
huge.
year, last year Buckeye, we saw right around 80,000 patient visits for back pain, neck pain, shoulder pain. We specialize in sports and spine injuries. And I'm proud of this. A lot of patients. We helped a lot of people last year. We prescribe no opioids because it makes no sense in orthopedics. It makes zero sense. When I get out and I talk to people, last year in the United States, 33,000 people died of opioid overdose. And that's from prescription. We're not talking about heroin. We're talking about regular opioid overdose. And then I just saw two crazy things in the past month on the news. That 33,000 number is actually 25% higher because what they did is they went back through all the death certificates, and 25% of them that said overdose, when they really looked, was opioid overdose. So now you're talking, almost 800 people a week die in the United States from opioid overdose. That's ridiculous.
From something you can get over the counter.
Yeah, that's ridiculous. And then I saw something that came across on my phone yesterday. It was on CNN. You could probably, you could fact check all my stuff. This year, for the first time, the average age of U.S. people is going down instead of up, and they attribute it to opioids. And that they figured out, and I don't know how they figured this out, is the average American is going to live 2.5 months less due to opioids. That's how.
Because there's so many out there.
Because so many people are dying, and you put it in the big factor of things. So if you're listening, so you're taking opioids, Percocet, Oxycontin, Vicodin, whatever the garbage is for joint in your knee or your back, it's a dead end street. You'll never get better. It's only going to get worse. And not only are you running the risk you're going to get addicted, there's an epidemic of kids hooked on this stuff, and you know where they're getting it.
Yeah, I learned it by watching you. That commercial was on when we were kids.
Yeah, they stole it from their mom and their dad and their grandma and grandfather. So even if you think you need it, you need to put that stuff in a safe, because what happens to these kids is once they can't steal anymore, then they go hooked on heroin, which is a whole other animal. So, anyways.
So an opioid basically is the real gateway drug. It's not. It doesn't get looked at that way because it's supposed to.
Well, anyone on heroin usually starts with opioids. Opioids are they're harder to get. You got to steal them off your parents or grandparents or wherever the hell you get them, and doctors won't prescribe them as much. So what do you do is you still want to get that fixed. So you can go get heroin on the street, which is cheap. But it's I've worked with some people that have been addicted to opioids and heroin. Man, it's terrible. It's not them. It's the devil, man. Right. It's crazy.
Because once you start it, it's in your system and you can't kick it.
Yeah. Yeah, so that's my passion, to get people better, whether you're taking an opioid or a muscle relaxer or even an NSAID, which is a non-steroidal anti-inflammatory, Aleve, Tylenol, whatever garbage that is. None of that stuff fixes any type of joint pain. It does not fix it. It masks it. So it's equivalent if I'm driving the radio show today and my check engine light comes on, it's like me putting masking tape over the light. It does nothing to fix it. It's just masking it, right? And and even worse than that, when you're taking those medications, you're probably messing yourself up worse than you're doing stuff you shouldn't be doing, right?
Right.
So, anyways, I don't know how we got there.
We started with Utah. We started with Utah, and then we just went on. We went on from stem cell. And
Utah was awesome, I'll tell you that.
Yeah. I mean, one of these shows you should just tell us what you saw. But, again, I thought it was important for you to talk about the fact that a lot of people will say, here's how weight loss works, here's how HRT works. You actually went to the source. So you went and saw how it was done for yourself. Whereas I think a lot of people will say, I'll just sign up and I'll have patients do it. Like, You really
Me
get
and I
into
drove Dr. Bannon out there with me. So
I'm
I
sure
gotta
she
give
was
her props.
happy. I'm sure she was really happy. We got 6 hours.
Actually,
trip.
getting there wasn't bad. The way back's terrible because you lose 3 hours in a 6-hour flight. So the way back was horrendous.
I'm glad I wasn't seeing her that week.
But no, she's a trooper, and it was really cool. And even more confident in the product. I see how they process it. And as I said, it's cord tissue, not cord blood, so there's no matching issues whatsoever. And those cord stem cells, the mesenchymal cells, I mean, they're the best. They're really good, and the proof's in the pudding. We see people every single day at Buckeye, pre and post MRIs, pre and post X-rays. The results are crazy. People probably think they're photoshopped when they see them. That's how crazy the results are.
Well, you showed me one in the lobby one time, and I could not believe it was the same person's knee.
I mean, it works every single time as long as the person lets it work. You know, you gotta wait a couple. You know, when you get the procedure done, and I say this, unfortunately, that's not going to sound weird. When you put stem cells in, one of the first things it does is it shuts off inflammation. Inflammation's pain. So people usually get some pain relief pretty quickly. So, but just because you're not in pain doesn't mean the thing's fixed. You know, you're not going to regrow a knee in 3 days.
Right.
So it's very important for people when they get these procedures done for the first 2 weeks, basically, to lay low. Don't decide it's a good time to go to Disney World or go hiking in Hocking Hills just because you got your knees done. But then after 2 weeks, it's pretty simple. If it doesn't hurt, you can do it. You know. So if you're listening, you know, get your blood work done. I always say that. I have to. But
I say that every week.
but if you're suffering with any of the symptoms of hormone deficiency, male or female, and if I had to cast my vote, it's more important for females to be on hormones than males. That's just my opinion. Just because the whole estrogen thing and osteoporosis and lots of other stuff. But it's important for both. And if you're sitting around and someone's told you you're eventually gonna have to have your knee replaced, your back surgery fused or whatever, come to Buckeye and let us look at it. If we can help you, we'll let you know. And if not, I'll let you know too. There's some things we can't help, right? But isn't it worth a look just to see? So you can check out our website, which is BuckeyePMR.com is a site. If you mention the radio show, you can come in. The consult won't cost you anything to check out the hormone replacement therapy or the stem cell or regenerative medicine procedures we're doing. I talked a lot today. I didn't let you talk. Sorry.
No, it's people listen to this for you, not for me.
Jim's still sweating.
Yeah. Good thing we're running out of time for this week.
All right. Well, anyways, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com is the website. And until next time.
Did you hear about the woman within the last week